Good afternoon, members of the Assembly, and thank you very much to Assemblywoman Glick for holding this hearing. I'm sorry that your head is exploding with this information, but I will keep this very simple. We have a PFAS crisis. According to the U.S. EPA, we have in New York State alone over 3,500 industrial sites that are either using, discharging, or manufacturing PFAS chemicals throughout the state of New York. Also, according to our own water data, we have over 3,000 water supply districts that have PFAS being tested for in some levels throughout New York State. 98% of us have PFAS in our blood. This constitutes a PFAS crisis. I want to break it down. What can New York State do? And I think one of the challenges, I think you're going to agree with this, is we get lost in the science because it's developing, it's new, it's voluminous, and it's scary. But 4 things: sewage treatment plants, industry, septic systems, and common household products. We may want to include pharmaceuticals. That's not my area of expertise. I'm going to stick to these 4. Here's what New York State can do, because I assume that this hearing is about that. What can you do to help? Well, we have specific suggestions. As was stated, New York State has made some good steps, which we appreciate, right? Banning PFAS from food wrappers and carpet material, firefighting foam, and also apparel, good steps. But that's us playing whack-a-mole with the PFAS issue. We need a holistic approach. We need, for the Assembly, to pass the comprehensive bill on PFAS, banning it in products. We can go through the products. You already know it. We don't understand how or why cookware was eliminated. No person has ever said, I hold higher the ability to slide my eggs out of the frying pan than I do fighting thyroid cancer. Said no one ever in New York State. So I don't know why we're eliminating common threats and concerns to the public from the multi-sector bill. Let's put cookware back in. Let's pass that bill. Why? Because regulations work. Not that long ago, you guys passed the 1,4-dioxane limit in common household products. You limited it to 1,000 ppbs. What happened? It worked. Tide used to have 15,000 ppbs of 1,4-dioxane in it. Now they have 450. Why? Because you told them they had to do it. That's why. Dreft baby laundry soap had 10,000 ppbs. Now they're down to 550. Regulations work. And good news for you, not only are they using the new reformulation in New York State, they're using it throughout North America. So you're welcome, Canada. You're welcome, Texas, because New York passed the law. Be brave. Pass the law. There are alternatives, as was stated earlier. We can pass the multi-sector bill. Second thing we can do is pass the Packaging Reduction Act, because the Packaging, Recycling, and Reduction Act also will reduce PFAS in packaging materials. Another way to get it out of our products and get it out of our environment and human contact. Another thing we can do, please, is New York State is well poised to accelerate the EPA standard of 4 parts per trillion. As you know, we already have a 10 parts per trillion. There are districts across New York State right now drinking water between 4 and 10 ppt. They're real communities with real names, like the village of Hempstead, the largest village in the country with 52,000 people in a very low-income community of color that would benefit from accelerating the implementation of the 4 PPT. Village of Mineola, 20,000. Water District of Jericho has 52,000 population. Those are just some examples of real life, real people who would benefit. The other thing is, please, as was stated earlier, CCE has founded and co-chairs the Clean Water Coalition throughout New York State. The wonderful groups I'm sitting with are members of that coalition. The next panel you're going to hear from, and those wonderful organizations, they're members of the coalition. We're all asking for $600 million. The fact that there was a proposed budget by the executive branch last year slashing the clean water budget is scary. We have a crisis. We need to maintain the funding to address the crisis. We need for our water to be clean and affordable to the public. It's a basic human right, and we need everyone to be working collaboratively and collectively to achieve that right. Here's what we think we need to do with industry. Right now, as was stated, there are no real restrictions to discharge of PFAS. Every speedies permit needs to now include testing for PFAS. It's an easy thing for the legislature to do. Those test results need to be mapped so they're transparent, but also they're knowable. Overlay them over drinking water sources, then we can develop an action plan. Because Assemblywoman Glick, you asked the question, how big a problem is industry? And the real answer is, we don't know. But we can get that answer. We can't keep doing the whack-a-mole and trying to address an issue without the data. So requiring testing in all speedies permits, mapping that testing, overlaying it with drinking water wells and drinking water sources will give us the ability to know what areas are threatened, what areas are already polluted, and maybe why, and give us a way of developing a priority criteria for action. At least it's a start. The other thing we can do is, this hasn't been said yet, and we would appreciate this, I'll make it quick. New York State can stand up to the Department of Defense. I know Assemblywoman Giglio knows something about this. The Department of Defense is not defending us, so we need you. All across New York State, whether it's the Navy or the Army, they have invented their own PFAS policy. Prior to 2 months ago, they were still using cleanup at 70 PPT, which was that arbitrary public health advisory standard that the EPA had based on nothing. No one uses it. So I sit on 2 different restoration advisory boards for the Navy and cleaning up Superfund sites. We would have arguments after arguments about we don't want to talk about cleaning up the 70 PPT. New York State standard is 10. You're in New York State. They would tell us, that's the Department of Defense policy. And then EPA came out with the 4 PPT, and they said, okay, well, Department of Defense is going to use 12. So we had a lively meeting in which we asked over and over, where did you get 12 from? They said 12 is 3 times 4. I said, yes, I understand math. We're very good at it in the nonprofit sector. But is it based on health? What is it based on? And they finally stood up and said, it is a mystery. I said, no, a mystery is the Bermuda Triangle. Okay, a mystery is who built the Sphinx. The mystery is not where did you get the drinking water standard of 12 from. So we need New York State to stand up for us and make sure we hold the federal government accountable to cleaning up our toxic sites across New York State to New York State standards at least, or to the federal standard of 4 PPT at best. And last but not least, I want to say the New York State Health Department needs more staff to do this. If we're going to have speedies permits that require testing, we're going to have mapping, we need to do this. This is a necessity. Well, we need staff to do it. We've never asked you before, I don't think, for staff for the health department. We've always asked for staff for the DEC. This year, we really feel like the health department needs staff in order to really address the PFAS crisis. And the very last thing I'm going to say, because I have 59 seconds left, is I heard testimony earlier come from the DEP in New York City, who said, we don't want to scare the public. We don't want to scare the public into drinking bottled water. Well, Assembly members, if the truth is scary, tell them. In a democracy, we tell the truth. In a democracy, we have transparency. In a democracy, we don't hide scary facts from the public. We tell them, we educate them, we engage them in the change we need to make. So please don't back off or be afraid to tell the truth. We support you in that. We'll back you in that. Thank you very much for the opportunity to comment.